morning, everybody. It's Dana Brigman from the Canine Coach and Natural Wellness for Dogs, along with my good friend, Dr. Barb Fox. And hi, she'll share information about how to reach her and her telemedicine support shortly. But today we're going to be talking about all the things you might need to consider having in what some of us call a go ready or be prepared type kit for almost things that are first aid, would you say, Dr. Barb, instead of rushing off to the vet, and to know when it's appropriate to do sort of home care versus, oh my God, I really do need to be in the car. So welcome and that topic and yourself to us, and we'll get rolling.
All right. Well, thanks again, Dana, for having me on your show. This is fantastic. For those of you who do not know me, I'm a holistic veterinarian in Northeast Iowa. And like Dana mentioned, I do telemedicine, which is basically consulting over the phone and over the internet on cases that you may, need a second opinion on or want to take a natural or a holistic approach. And we're going to talk about that today because that's really important, I believe. And people who want to reach me can call me directly, leave me a message at 563-380-0983, or you can contact me through my website, which is Barb Fox, like the animal, F-O-X, barbfoxdvm.com. So I know Dana has my contact information too, so if you didn't catch that, you can contact her and she can give that to you too.
Yeah, we'll also include it in the like the podcast notes and everything, so it'll be in the text that they can read.
Okay. Perfect.
Tell us about this topic from the veterinary point of view. I think a lot of times as dog mamas and pet parents, anytime we see a dog that changes into something that looks like he doesn't feel well, because he can't tell us what it is, we panic. We get real concerned and rush off to the vet, where even with our own selves, we'd be like, oh, I'm fine. Let me just wait for a minute and see how this goes or if it passes. But with our dogs, we get a lot more upset and worried about any sort of change in how they feel.
I think that's really important, Dana, to address because first of all, I want to talk a little bit about what natural medicine actually is. So if you look in the dictionary, the definition of natural, it just means something that cannot be produced by man. It has to come from nature. So it's kind of a broad term. And I do warn people at times when they look at a product and it says all natural, that just means that it can't be produced by humankind. But it may include things that are not so natural. So just kind of keep that in mind.
I've always understood that to mean that if it can be produced in nature, right, that, and it might have had something that was produced in nature, they can call it natural, even though there may be other not so good or synthetic or lab made type.
Right, correct.
Within, yeah.
Right, yeah. And so then we talk about holistic medicine. It's a little bit, we're all kind of like putting this under a broad category of natural, but holistic means that a doctor or a practitioner, when they're taking a holistic approach, we look at everything. We look at the physical, the emotional, the spiritual, and the social well-being of that either person or animal. And for example, if you take your dog in and it's the 4th ear infection that dog has had, most conventional practitioners will just repeat what they did before, which is insane in my mind, because the definition of insanity is doing the same thing over and over, expecting different results, But a holistic practitioner like myself will start, oh, this is the 4th ear infection you've had. First question I would ask is, what are you feeding your dog? What treats are you giving your dog? What supplements is he or she not on or on?
Right.
And then we look at all the chemical exposures. When was your pet last vaccinated? And the majority of conventional practitioners will just look in the ear with the otoscope and just go, yep, we still have an ear infection. We got to repeat what we just did. So my whole point in bringing that up is taking a holistic approach. We look at Is there chaos? Is there strife in the home that may be causing stress, which shuts down the immune system, and it's creating, a symptom of an ear infection? Looking at the food, is there a food sensitivity that's causing that ear infection? So to me, when we have a holistic approach, it's a much more effective, even cost effective, because you're not running to the veterinarian every 2 weeks for another round of antibiotics and steroids. Excuse me, I've had a cold the last couple of weeks, and so my voice kind of cuts in and out.
I can relate.
So I apologize. Yep. And, just you think about skin infections or itchiness in dogs. You take your dog to the vet. Oh, yep. Looking at the skin, looks like it's a little flaky, a little dry. Let's put it on steroid and antibiotic. Nothing is mentioned oftentimes about fatty acid supplement, changing the food, putting it on a digestive enzyme to avoid leaky gut, all these things. So I don't know if that's, I guess that was what I'm trying to say is, to me, that's the only way to practice medicine.
Right.
And we've gotten so far away from that, where pharmaceuticals are the first line of defense, when actually natural medicine or natural products, the way that God intended to heal our bodies and our dogs' bodies, that should be how we should approach it, in my mind.
Yeah.
And it was just.
Go ahead. I'm sorry.
No, that's okay. Go ahead, Dina.
I was going to say, would you say it's more treating the symptom, in traditional meds, than it is stepping back and saying, what is the root of this thing, right? Why is this happening?
Right. And a really good example I can give you is, I just had a client contact me. I'm consulting with her tomorrow, and she has a cat. The cat is 16 years old and is diagnosed with non-regenerative anemia. Non-regenerative anemia, or any anemia, is a symptom of something deeper in the body. It's not an actual diagnosis. And so what pharmaceutical based practices do is they're going to treat this cat with steroids to hopefully bring this red cell count back up, regenerate the blood cells, which may or may not work. I, as a holistic practitioner, and any holistic practitioner, would say, what's causing the anemia? Is it the kidneys? Is there an autoimmune disease going on? Is it a vaccine reaction like vaccinosis that's causing this? So that's where, like I said, when we treat symptoms only, we're not getting to the root cause of the problem. And that's why we have all these recurrences of these chronic conditions.
May I
Does
ask
that make sense?
Yes, it does. May I ask a question about the use of antibiotics and steroids? And again, we get into this, let's do another round. Let's do another round. At what point should we as pet parents say, that's not working, right? Because it's very difficult for a lot of pet parents to challenge their veterinarian. And most of us will say, especially to somebody like me, they'll say, but the vet said, right? Shouldn't an antibiotic show some result? I mean, I'm not sure I'm going to ask this question in a clear way, but if I give a round of antibiotics, shouldn't I be able to see that it did something, not that I just need more or longer of it? What?
Yeah, you should be able to see that within 2 to 3 days, 48 to 72 hours. The problem is, if you haven't fixed the root cause of the problem, those symptoms are going to come back, and then more antibiotics and more steroids are going to be prescribed. Antibiotics are problematic in itself. And don't get me wrong. I mean, if a dog comes in with 105 fever and they're coughing or there's something else going on, they're going to get an antibiotic, because we don't want that dog to crash on us. So I use pharmaceuticals as an emergency in an emergency situation, Dana, or I, will use that to save the life of an animal, But if a condition comes in that's not really bad, I'm going to use my alternative or my natural products first. And I shouldn't
Right.
say alternative because I really think that should be the first line of defense.
Yeah.
So I kind of got off track there.
Well, I led you down that path, and I have a whole bunch of questions that I could ask just on antibiotics. So maybe what we'll do is have a conversation on that in a future podcast. And
okay,
I'll let
perfect.
you get back to this topic.
Yeah. So what I was going to say about the antibiotic is that it may take the symptom of like you've got some crusty skin on your dog, may take that symptom away. But if it's leaky gut, if it's a gut microbiome problem that's causing the itchy skin or the inflamed skin, the antibiotic is going to treat it in the interim because maybe there's a staph infection from the scratching now. But if we don't stop that whole cycle, it's all going to start over again. And this is where I get so frustrated by my colleagues that don't get this. You know, they just don't understand that if we have leaky gut or if we have a deficiency in the gut microbiome, and what I mean by that is we've got a good balance of bacteria, beneficial bacteria in the gut. We have to have that. And if we don't have that, then we're going to have these recurrences of the symptoms. And it's a vicious cycle. And, you know, for example, I had a lady that, it was several years ago, I had my physical office open yet. And she brought her she had a cute little Shih Tzu mix that she brought in. And this dog had been scratching so much, it kept her awake to the point where she's having to take 2 sleeping pills at night to be able to sleep. She'd been to her conventional veterinarian and prescribed a very expensive prescription food for allergies, and then was on antibiotics and steroids for about 6 rounds. This is over a 2-year period. And every time she went off medications, the itching came back. She brought, I kid you not, Dana, she brought in to my office 2 heaping plastic bags full of supplements that she bought over the course of probably 6 to 8 months, and wanted to know what I thought of them. She dumps them out on the table and she wants my opinion. I'm like,
throw them away.
I don't know what's in this stuff. I've never heard of these companies. I let her keep maybe 2 products that I knew about and trusted, but the rest of them I said, are you willing to, you don't have to throw them away right now, but just, you know, let's see what happens. She goes, I'm desperate, I'll do anything. So all that I did was I started her on an essential oil blend that she could rub on the skin, put her on. I gave her a real simple homemade recipe because she really was not ready to go raw yet. And she started that transitioning. And then I had some pharmaceutical grade supplements, or should I say medical grade supplements, that I started her on, only 2. And within 72 hours, that little dog had stopped scratching to the point where she wasn't having to take a sleeping pill. And in 3 weeks, the dog was pretty much itch-free, totally.
That's awesome.
And she was just like, wow, you know, and she's now the one that she gets it. She is very, very cognizant of any vaccine that goes in her dog. We've talked a lot about that. And she got a new puppy here recently. And, you know, I talked to her about the vaccine schedules and what the over-vaccinating could do. And so she's totally on board. And she's a very happy client now because she understands that she just couldn't keep doing the same thing over and over and over and not having any results.
Well, and not living through the misery. The dog's miserable, she's miserable. I mean, you can't heal that way.
Right.
So what should we have at home in our little staple collection of products? Because we all need one. What's your recommendation to the typical dog mama?
Okay. So you probably know this, your listeners probably don't. I heal a lot of things in animals through nutrition and essential oils. And this is how I healed my own body from cancer. Mainly nutrition, an attitude of gratitude for everything, and essential oils. Excuse me, I'm going to mute myself just a second.
Okay.
So in that little kit that I would have you have every pet owner have, especially dog mamas, would be an essential oil blend called Digize or Paragize, which is the animal version of Digize. Digize is an essential oil blend that has several oils that support a healthy digestive system. So if your dog has diarrhea, if it's constipated, if it's nauseous, if it's vomiting bile, doesn't make any difference. Digize knows, I mean, these oils go through the body, they know how to fix things. And so instead of running your dog to the vet because it just puked twice this morning, try putting a drop of Digize on his belly and seeing if that takes care of it, along with not feeding the food. You know, I have a lot of people that don't even realize that they could withhold the food for 24 hours and just offer water. Oftentimes that'll stop diarrhea and stop vomiting.
100%. And may I also ask you to speak while you're on that subject? So to be clear, fasting a dog that just threw up is not a bad thing. It's a good thing. Let the belly settle. We do not have to rush to chicken and rice. Can you comment on that? Because most everyone does.
You know, I would say put yourself in your dog's place for a minute. If you've been nauseous, the last thing you probably want to do is eat. And if you do eat, you're going to eat some dry toast or some soda crackers or something until that gut settles down. But you're probably not going to have an appetite for a while. And it's the same thing with the dogs. So yeah, it doesn't hurt them at all. People get really worried. My dog didn't eat today. Well, dogs in the wild don't eat every day. They might eat 2 or 3 times a day and then go 2 or 3 days without eating. So we have to think about how would they be in the wild? How would nature take care of this? And so you're absolutely right. It's fasting is a really good way to get that gut settled down and get things back to normal. Give the body a chance to rebalance.
Without carb loading. That's the key.
Correct.
And the other thing, the other thing I'll share here is I love Digize. I am never without Digize in my purse, in the house, where I travel. I use it for me and the dogs. And that's one of the beauties about these products I think you're about to describe is that they are shareable between the human and the dog. Even though you mentioned like the Paragize is a dog friendly version, would I use Paragize? 100%. You know, so we don't have to have 2 collections of things for the dog and the people. We can all use the same kind of stuff.
Right. And I just tell people use what you have. You know, even the tummy jize, the kids sense tummy jize you can use on your dogs perfectly. It's just more diluted down. So especially for your smaller dogs, this is a great option. But if you don't have that, just take your Digize and dilute it out. Right. Another thing that I would keep in that kit would be Copa Iba. That's a really weird sounding oil name. Copa or Copal, I think is the kind of the generic name for that. But Copa Iba is really good for inflammation and pain. So your arthritic dogs or your dog that just slipped on the step and hurt his knee, get some Copa Iba, maybe some peppermint oil on it. Peppermint's another one. I have 3 oils, Dana, that I consider Swiss Army knife oils. One would be lavender, the other is frankincense, and then the third one is peppermint. And I have a lot of people that tell me, oh, I didn't know I could use peppermint on my dogs or my cats. And there is some truth to that. If you have a cheap oil that you just picked up at a big box store or you bought off of the internet, you're not sure it's really cheap. No, it's not going to work. Now, you know, and I want your listeners to know that Young Living Essential Oil Company is the only oil company that I trust, especially for animals. I mean, I've been using them for 15 years in practice, and I would never use any other. Only because, I mean, the reason I say this is because when I first started out, I thought all this hype about Young Living was just, it was Hollywooded. Oh, it can't be that good. And so I use 5 different companies' oils. And I just kept going back to Young Living because either I wasn't getting the results that I wanted or it's having some negative effects with those other cheaper adulterated oils. And what I mean by adulterated is an oil company can add diluents. That is something that makes the oil last longer or spread out, but it's not as effective.
Yep.
They can add chemicals to preserve it. They can add chemicals to flavor it. And so if you hear of a dog or a cat that has had an adverse reaction to an essential oil, I'd say, what company are you using? Do you know what's in that oil? There should be nothing in that oil bottle except the pure essential oil.
Right.
Okay. So just keep that in mind when you are, I always say, there's always a chance if you're not using a quality oil company like Young Living, you could have some deleterious effects from the oil. So anyway, going on from Copaiba, lavender, I mentioned that as a Swiss Army knife oil.
Mm-hmm.
It's perfect for relaxation. I mean, if you want your dog to chill out, lavender is perfect. It also is great for itchiness, allergies, skin irritations of any kind. Even if you've got, one of these white dogs that has the pink nose and it gets a little sunburn, lavender is great for that. It's just lavender is just, if you don't have anything else in your kit, grab the lavender, okay? Because it can do a whole lot of things. Yeah.
Yeah.
And go ahead. I'm sorry. And then frankincense is another one that I think is perfect for support of the immune system. When I had the breast cancer back in 2007, that was one that I used every single day, because if you go on to like a government website called pubmed.gov, you can find hundreds of articles on how the boswellic acids in frankincense actually can kill tumor cells, but preserve the good cells. We call that cell apoptosis. And so frankincense is one of these oils that I think the last I'd heard, it has at least 150 known activities.
Wow.
And probably more. Science just hasn't discovered yet.
Mm-hmm.
So frankincense, think of skin, think of respiratory issues. It's great if you've got a dry cough or a little tracheobronchitis. You've got the dog with kennel cough, put a little on his throat, works great. But especially for the immune system.
I actually didn't know about it for respiratory support. In fact, I'm going to have to try that for myself later today.
Yeah.
Is there a difference between the frankincense, like Sacred Frank versus Frank? One is Boswellia cardiae. I can never say the Latin names appropriately, but does that matter when we're shopping?
There's a price difference. Now, the Boswellia cartieri, the one that you just mentioned, is usually a little less expensive. Now, the Boswellia sacra, which is sacred frankincense, is a little spendier, but has a milder scent to it. And so I prefer the milder scent. Yeah. I don't think there's any real efficacy differences, Dana. Okay. So whatever trips your boat or floats your boat or trips your trigger, that's what right. I go with.
Yeah, but a $4 frankincense from Publix is not going to do it.
Oh my gosh. I've intentionally purchased some of those cheaper oils so I can smell them. Yeah. And yeah, it's just almost like repulsive when you smell these. They're not pure.
Right.
And especially lavender. If you're buying a bottle of lavender for $3.95 at a big box store, I can guarantee you it's not lavender. It is all synthetic.
Yeah.
Yeah.
And read the label, because I've seen many a bottle of lavender or many a bottle of rose. Pick a topic, right? Pick an essential oil category, and then it'll say on there for aromatic use only. I'm like, if I can't put that on my skin, what was the point of it?
Exactly. I've had a lot of people say, oh, I use this oil, but I'm not using it topically, but I'm putting it in my diffuser. Well, exactly. It goes right into the lung tissue, into the alveolar tissue in your lungs, and right into your bloodstream. Hello. So I don't mean to pick on people, but I think that people need to be aware of this, that whatever you breathe in, you put on your skin or you drink it, it all ends up inside your body.
Right. That's right.
Yeah. All right. So moving on to another oil blend that I would consider having dog owners or dog mamas have is Panaway. So if your dog has just slipped down the steps, or maybe it got kicked by a horse,
Or
you know,
if
that
it's
happens
like
a lot.
Poppy and it does banking when she's playing with another dog and the legs fly out from under them.
Right.
Yep.
Because Panaway has clove, which is a really good topical anesthetic type of oil. And with the helichrysum, especially for bruising, if a dog has been bumped or, like I said, kicked by a horse, this is a great oil to have. And the pain relief is almost immediate. Panaway is actually pain away, but for FDA purposes, we took the A out and put the PAN in, okay?
And it has wintergreen in it also, right?
For for the pain.
And a lot of people are going to read and go, oh my God, I can't use wintergreen on my dog, or because of the aspirin-like effects, which is simply not true with this product. Our dogs can use this.
Well, I'll tell you, Young Living was out of Panaway for quite a long time because with the weather changes and the dryness and the fires out west last year, they could not source a good wintergreen.
Right.
Other companies were using the synthetic wintergreen, which, and so where was I going with that?
Well, we were talking about how the interwebs will scare everyone to death and say that we can't use wintergreen with a dog, right? We can't use it.
And I would say, if you know where your wintergreen is, you know the quality of the wintergreen, yes, you can use it. But again, I was going to say Young Living was out without Panaway for quite a long time because they couldn't find a good, pure, clean source of wintergreen. And so people need to be aware of that too, is the companies that have been in business for a long time and that tout their quality as being pure and genuine are the oils that you can use, but not to go out and buy that rejected wintergreen from another company.
That's right.
So, okay, another oil to have on hand would be peppermint. And I mentioned this earlier where a lot of people are scared to use peppermint, but peppermint is a very, very strong oil. And I've done dumb things in the past, like take the cap right off of the bottle and oh, wow. Yeah. It's almost like your lungs are on fire and your nose is burning, you know? And so we have to be a little cautious of that. Peppermint should always be diluted out. I don't care how big your dog is, go ahead and dilute it out before you apply it topically. But what peppermint can do, especially like your dog just gets stung by a bee and you start to notice a little facial swelling just in the very beginning, get the peppermint on and the lavender on right away because it stops pain almost immediately and it takes care of a lot of swelling and inflammation. Peppermint is always good for digestive issues and respiratory. You can do a few drops in your diffuser if you've got a dog with some respiratory issues, and it will help with that a lot. Another oil, I would consider having Valor in that emergency kit. Now, Valor's nickname before the FDA kind of gagged us from saying this was chiropractor in the bottle. So if you have any spinal issues, if you have a dog that has an ACL injury, if you have a dog that is older and has degenerative issues, Valor is great for that. Valor will not do a chiropractic adjustment, but it energetically will realign that spine. And what I mean by that, that's all in the realm of quantum physics, which don't want to get into right now, but just trust me that Valor energetically aligns the spine and the other bones in the body.
Yeah, it's one of my favorites.
And I know that, and there are a lot of things that we can put in this medical kit. But those would be the ones that I would not fudge on. Do you have any others that you have, Dana, that I haven't mentioned that you would consider a must-have in there?
The only other, well, there's probably a lot that, I overdo everything. I overdo it all. But I also like having lemon on hand for cleansing. Now it's going to be one of those, oh my God, that stings if you're putting it down in a wound or something. But I like to use it if I'm out sort of in the field and something emergent happens, to cleanse my hands, sort of to get that ready for me to interact with a dog that may be injured in some way. Never going to spray it or pour it directly into like a wound care, but to help with the cleansing of the area around it and that sort of thing. I like having lemon on hand.
Well, that's a really good point. Lemon is really good too. So if you've got a dog with digestive issues, bilious vomiting, which means they're vomiting bile, or they have like the reflux type of vomiting, they don't feel good in the morning because there's too much stomach acid buildup. I've actually had dogs, I put lemon in my hand before, and they come over and lick it out of my hand, and they make it kind of a funny face like, whoa, and then they keep licking it. So their body knows what they need. And I was going to say too, even a dog that has had a UTI or has any kind of kidney issues, let them have some water with 2 or 3 drops of lemon in it, a full bowl of 2 to 3 drops of lemon. Also have a bowl of just plain water.
That's right.
They will know what they need. And I've had a lot of dogs prefer the lemon. I had some dogs that just prefer the regular water. So whatever they need at that point, they're so much more intuitive than we are, it seems like. Yeah. And I was going to mention, I forgot to mention this, that Young Living has an essential oil blend, and this should be in your emergency kit or your urgent care kit, of the animal sense oils. There are 3 main ones for wounds. One is called PuraClean. So that's what you would use to clean out a wound. Then Infect Away, so you're disinfecting the wound. And then Mend Well for tissue repair.
Right.
So these oils are all pre-diluted out, and they can just be used as is. If you've got a smaller dog, anything under 15 pounds, probably dilute it out a little bit more. But gosh, this might keep you from having to run to the vet. My dog just, tore a little piece of his foot pad when he was out on the gravel. Use these oils, and I'll guarantee you 90% of the time you won't have to go to the veterinarian's office. Okay.
Would you also keep thieves in your ready bag?
I probably would. I just caution people to be aware that thieves is a very, very strong combination. I know that some people give thieves in a capsule to their dogs. Because I can't communicate verbally with my animals to know if it's causing discomfort or not, I generally don't do thieves orally, the thieves vitality. But you can diffuse thieves. You can use it topically if you dilute it out a lot, because of the cinnamon clove in there. It's very, very spicy. And I don't mean spicy. I mean, it smells spicy, but it's a little bitey.
Right.
Okay. So
I have used it more than once in a gel cap, where I've taken copaiba, lavender, thieves, and even some oregano for some urinary type, the pee-pee squat type issues of like, oh my God, this is unpleasant and I can't get it all out. Top that off with coconut oil and then slather it in a coconut oil. So there's a lot of fat going in with it.
Yeah.
And I have literally seen that stop the pee-pee squat in its tracks on more than one occasion. So
yeah. And I, just as a veterinarian, I'm a little more cautious. If I know a client, I'll say, hey, here's, do this, don't worry about it. But as a veterinarian, especially if I'm dealing with a client that is not familiar with essential oils, the last thing I want them to do is go, I was way too strong and I'm not doing that anymore. So I start out slow, and you can always increase the dosage or, whatever. But I think that's really important to know that you put the coconut oil in there, because coconut oil is going to soothe the gut lining and the stomach lining so that these essential oils won't be so bitey.
Exactly.
Okay?
Yeah. So for me, when I've done it, I put a few drops of coconut oil to top off the gel cap before I closed it. And then I used non-fractionated coconut oil, just a big old scoop of it as it went in with that gel cap.
Perfect.
And then I think the other thing we should have in that ready bag is the ointment, the animal sense ointment.
I had that on my list here. Yeah.
I knew you would.
Yeah, the animal sense ointment is superb for these little scrapes, cuts, abrasions, and also if you've got a bigger wound and you're putting oils around that wound or in the wound itself, the animal scent seals it up. And especially in the summertime, the flies and the gnats can't get in those wounds because they're going to be repelled by the scent of the animal sense ointment.
Right.
Another thing that I would consider having on hand all the time for your dogs is sulfurzyme. Sulfurzyme with the MSM not only is a fantastic way to support the immune system, but it also provides pain relief. It takes inflammation and swelling down. And what else I have here?
Would there be any Dr. Barb that can't have that at a certain time? And I'm thinking about those dogs with like pancreatitis or IBS or IBD. What did we call it last week? Irritable bowel syndrome, I think is the word. But are there
inflammatory bowel?
Yeah. Are there any conditions in which we would not use something like sulfurzyme to go into the body?
Well, sulfurzyme, because of its anti-inflammatory effects, if you have pancreatitis, did you have a problem using sulfurzyme in
I have not. I'm just asking because I've got 2 clients in my brain right now whose dogs are really pretty unhealthy, and they have just reached out. I mean, they're like new customers, new clients, but both have some severe pancreatic issues. And the other one of them has both pancreatic and IBS, according to the vet. And he's in he's in a mess. He's not doing well. And so I'm in that delicate situation of they want to change the food. They want to get him off this prescription diet the vet has prescribed, but we need to go slow enough not to create a big flare up. So.
Correct. Yeah, I think the sulfurzyme is excellent because in humans, sulfurzyme, or I'm sorry, I should say MSM, which is a big part of the sulfurzyme, it's good for leaky gut and gut microbiome health overall. So the other thing that if you've got these chronic pancreatitis dogs or EPI in German Shepherds, which is exocrine pancreatic insufficiency, I would use the essential zyme. Young Living Essential Zymes. Right. That is an excellent product for, I mean, everybody should be on that. I heard I heard Marcella von Harting say that enzymes are probably the most important thing that you and your animals can take.
And she talks about digestive enzymes even related to anxiety, for example. And I've had a couple of real bad behavior cases with anxiety, and I'm like, we're going to put your dog on digestive enzymes, and guess what happens? We see a tremendous improvement. It is amazing how nutrition and helping the body do its own best work resolves things beyond digestive issues, but they're all intertwined. I mean, we need that nutrition for our best lives is kind of the bottom line.
Right.
And I'm also amazed time and time again when I get the phone call of, we want to try this Volhard food, or we want to make our own food, or what supplements should we be using for dogs with pancreatic issues. And the vet has never, not once, mentioned a digestive enzyme or a probiotic to anybody.
Boy, and it's so sad. Because that can fix a lot of things and maybe even not allow that condition to happen in the first place.
Right.
Okay. Yeah. And so for our older dogs, I'm going to talk a little bit about Agiles and BLM.
Yeah.
These are Young Living products. Agiles says it all. It's agility. It eases agility. So think of flexibility, ease of movement, that kind of thing. I would oftentimes, some of these formulas change Dana, and I'm not aware of it unless I look at the label, but anything with xylitol in it,
Of course.
please do not give it to your dogs. I know you know that, but some of the Young Living products have xylitol, some don't, but make sure you read the label.
Yeah.
And like I said, the formulas sometimes change and I'm not aware of it until I look at the label.
Yeah.
But BLM stands for bones, ligaments, and muscles. And so BLM is a great thing to have. Agiles, I started talking to these dog breeders about putting their puppies on it, especially a large breed puppy. Because if you can mitigate any problems with those joints as a dog ages, hey, it's a win-win,
Yeah. And it's not
and
just for the older dogs, right? Puppy.
Correct.
So classic pity issue, at least around here, is we blow out the knees, right? And sometimes we blow them out before they're 1 year old because they're very athletic dogs, but don't always have the best of breeding. And so Poppy lived on Agiles and BLM as a young dog. We prevented, thank goodness, blowing out that second knee, but she blew her ACL before she was 1. And that's the products we use to support her.
Right, absolutely. But a lot of times, I work in a conventional clinic 2 days a week, but I'm allowed to do my holistic treatments and make holistic recommendations there. And I cannot get my the practice owner to stop grabbing Provocox or Carprofen or Duramax as a first line of defense in these dogs that have injured something or have arthritis that's not severe. I mean, I'm all for pain management. If a dog if you can't manage it holistically or naturally, sure, for quality of life, we add those drugs. Right. But the dog that just slipped and is maybe limping so slightly you can't see it, why grab the Provocox? Why not grab Agiles or sulfurzyme, combination of those things, your omega fatty acids, all of that.
Right.
Yeah.
Agreed.
Yeah. And one other thing that I would consider maybe keeping on hand is CBD oil for relaxation, for stress relief, calming, inflammation anywhere in the body.
Mm-hmm.
Okay.
Yep.
And, I think that what we're going to see, and this is my personal opinion based on 2 years of looking at this stuff, I see big pharma changing. It will not be the same as we know it when truth comes out about how these products are harming both people and animals. You're going to see a huge difference. And I can't wait because I see a whole revolution of getting back to how we should be treating our bodies and our animals' bodies with natural therapies, modalities, and products. It may not happen overnight, but I think people's perception of what regular veterinarian medicine is going to have to change too. They're going to have to open their minds to doing new things because I don't think these products are going to be available right now. Right now, you can't buy, a lot of places you can't buy horse paste, ivermectin. Yeah. You can't buy the dewormers because they're being used for other things, which I'm not going to get into right now. Right. And I see that with antibiotics. When COVID first, hi, when COVID was first mentioned, we could not get antibiotics. Veterinarians could only buy, I could only buy 1 bottle of an antibiotic at a time. And they were limiting it because people were getting so scared. Well, I need this for this and this and this. And that's where the supply chains are coming in. But I also think the supply chains are going to change when big pharma is exposed. And anybody wants to talk to me about this, I'd love to do it in private, but I don't think I want to do it publicly.
Yeah.
Just because, yeah. Right.
We don't want cancel culture, Dr. Barb.
Right, exactly. Oh, gosh.
I hear you.
Man.
So these are all great products to have on hand. Are there any others that you can think of? And then maybe help people know when, we talked about if the dog threw up, don't rush to the vet, just sort of step back fast, wait and see, put some oils on. I mean, obviously, if he's broken a limb or been hit by a car or some major trauma, we're headed to the vet. There are many of these same products we can use en route to the vet to help along the ride, right? But are there other sort of ways to think about when can we do something at home versus when is it truly we've got to go to the vet and get that checked out?
Deep Relief is another oil blend that I would highly consider having on hand. RC, which stands for respiratory congestion, that is another oil blend I would have on hand. And I don't know what's happening. I have my own theories about this, which I don't want to bring up right now, but I'm seeing a tremendous amount of cats and dogs coming in with respiratory issues, and they've not been to the dog park, they've not been boarded, they've not been anywhere, not exposed to other animals. So RC, for what it is, it's good for bone spurs too. I don't know if people knew that or not, but that's one of the things that I've used it for in the past, little arthritic bone spurs. But RC, Breathe Again, Raven Sara, eucalyptus even is a great one for sinus and respiratory issues. And then going back to people rushing to the vet, I see this a lot, and I've seen it more over the past 2 years. I think there's been so much anxiety and stress of people working from home. They're scared. Maybe they've lost their jobs because of whatever. And then the pets are the security blanket for the human.
Yeah.
And the pets are taking on all of our stuff. So I always recommend people putting oils on like Stress Away, Peace and Calming, any of the citrus oils, vetiver, valerian, using these oils to calm yourself. And that way, when your animal is sick or injured mildly and doesn't need to rush to the vet, it's not going to be a huge deal.
Right.
I just example the other day Wednesday when I was working at the conventional clinic, this dog came in and said it was non-weight bearing on right hind leg, and just happened. Okay, so I walk in the exam room, and it's a pity. Runs over, jumps totally on me, licks my face. So it is bearing weight. I could not determine at first which leg it was until the dog sat down and it just kind of put the leg out a little bit. Was that something that person probably had to run in? If it had been my dog and I had all these oils on hand, I would have done, probably the Deep Relief, Copaiba for sure, maybe a little lavender on that for the calming. And then, did the sulfurzyme and the Agiles. Probably that would have healed fine without the $75 office visit and whatever,
Right.
whatever medications that they took home.
Yeah.
And some people, I have to say, oftentimes I feel pressured into giving out medication because people expect that. And this is where I see, a big revolution changing or coming about, Dana, with pharmaceuticals, because people are going to find out that there are other ways that are safer and more effective than just grabbing the Provocox or the Carprofen or whatever.
I recently heard a vet tech, and I think I asked you about this because I didn't know if it was like a veterinary thing. But at least in this practice, if they have a vet visit, they are required to give a prescription. Exactly. So you have that is not normal.
Right.
But that's the thing. If you're walking in and you're walking out with a prescription for some sort of pain med for a tweaked knee that might have resolved easily with essential oils and whatnot in a day or two, and now you got this pain med or this joint supplement or whatever that may be overkill. We really need to start questioning those things on our animals' behalf. And then the other side of that equation is people are running to the vet, spending $75-$80 for a vet visit, maybe more, coming out with whatever stack of supplements and prescriptions. And then they say to me, I'm tapped out, my budget, it's a lot of money. And I'm thinking, if you had sort of this collection as you've described on hand, you're going to come out ahead. It feels painful in the moment because you're going to spend whatever couple $100 to build your little collection, but you can do that little by little. You don't have to buy it all at once. And then you start using it. That's the key. Use it, try it, see it work, and then go, oh, I just saved $75 because I didn't have to run to the vet for that thing. And if we change how we think about that, then I think people are going to see different results.
And I think too, Dana, those are really good points. I'm going to add that there's no expiration date on the Young Living oils.
Right.
Because there's no expiration date as long as they are capped fairly tightly, kept out of heat, excess heat, and out of the sunlight. They'll last years. They'll last for years.
Yes.
And in a 15 ml bottle, which holds about 275 to 300 drops of oils,
right,
and you're only using a few drops at a time, it's going to last a long time.
A long time. And I can use the same oil my dog uses. That's an additional savings, right? I don't have to have a urgent care kit for me of products and an urgent care kit of products for the dog. We're all pulling out of the same one. So that's savings, but it's super hard for people who are currently spending, the money's been flowing out for these pancreatitis issues or these ongoing allergies and antibiotics, and try this shampoo and try that. And they're depleted, and it's hard to say, okay, I'm going to trust this new process and I'm going to spend money on the proactive.
I'm probably going to put my foot in my mouth, but I'm going to say it anyway. I see as a trend where dog mama gets the little postcard in the mail saying Fifi is due for all of these things on the card. And the dog mama doesn't question anything, just says, oh, I guess we need to do this. They're spending anywhere from $150 to $200, sometimes $250 for those vaccines that they don't need every year. They're spending it on heartworm testing that probably doesn't need to be done every year. They're spending it on a chemical flea and tick medications
that we don't need at all.
Harmful to their right. And so if people really wanted to save money, I'm trying to talk to them and let's reduce this. Let's say, does your dog go to the groomer or board? No, she stays home all the time, or I have a pet sitter come in. Why are you doing the kennel cough vaccine then? Why are you doing Lyme disease when you're not in a Lyme endemic area?
Right.
These are just simple things that people can question. They can do their research and they can look at that and go, why am I doing all this? But very few people, and bless their hearts, these dog mamas are they want to do everything right. But I'm saying, start questioning your veterinarian.
Yep.
Start questioning the things that are on that.
Right.
And then you'll have the money to do all this other cool stuff.
Exactly. You'll have money to add fresher foods into the bowl. Even if you're still on a kibble diet, you can add something fresh to the bowl more often, Yeah.
Right.
So for those of you listening, I know I often sound pretty preachy and I try not to. And I know Dr. Barb gets fired up once in a while too. We're not judging. We truly want to help, and we truly want. Willow, you're not helping. She's looking at me but I am. I'm keeping a friend's dog and she is so loud, but we're not judging. I will shoot straight with people, but I will meet you where you are and help you figure out how to manage the budget, how to offset cost, how to improve the quality of kibble that you need to feed, right? And I know you're the same way, Dr. Barb, even though we get fired up on these topics because we're so passionate about them. I don't want anybody to feel like you can't call us and talk to us and say, but this is my reality. and I don't have many other options, because you and I both can help them move into different paths and save money in different ways.
Yeah, absolutely right, Nina. I'm the same way. I'll work with you no matter what you want to do, but we will work with the animal's interests in mind.
Yeah.
And your budget.
That's right. Okay. Awesome. I love this topic. I think we could spend hours and hours talking dog, and which is why we do this every month. So I appreciate you coming and doing it again. Any last words?
I don't believe so. I just would encourage everybody to question everything, like I just mentioned.
Question
Don't take
everything. And if you can't question your vet, come in the Facebook group and question things there. Dr. Barb's in our group, and we'll get you some answers. We'll help you start, even help you have a different conversation with your veterinarian. Here are the words to go say to him. And sometimes the words are no. No, we're not doing that anymore. No, right. I'm not taking that vaccine. Yeah.
Right. And if you feel bullied by your veterinarian, find another veterinarian. I'm very fortunate at the conventionally based clinic that I work at a couple days a week, that if I have the I don't want to say the power, but I have the option to, if I don't feel it's right for an animal to have a treatment that is recommended by the card that comes in the mail, I can decline that for that client. And then I was going to say too, Dana, if somebody wants to talk to me, just they want to maybe consultation, but they don't know what that all involves, feel free to give me a call, text me, or whatever, at 563-380-0983, and I can talk to you to see if we're a good fit to work together.
Exactly.
I've had it, right. And so that way people get to know me. I like to get to know my clients before we, end up having a professional relationship. And that way it's more personal.
Yeah.
Exactly. Yeah, exactly.
Yeah.
So thank you for having me on. This is great.
My pleasure. My pleasure. Please check out Dr. Barb's online courses. She has several about nutrition and other topics. She has a couple great books out there. And if you need holistic veterinary medical guidance, nutrition guidance, she does telemedicine at barbfoxdvm.com. Thank you. All righty, my friends. Well, I'm going to stop this